Hello to everybody. My name is Andersa Tegnella. I work at the Public Health Agency in Sweden as a state epidemiologist and a deputy director general. I'm very happy to join you in this remote way for your Freedom Games in 2020. And I'm recording this a few days in advance, as you see on the date. So I'll give you some background to the Swedish strategy and what we are trying to achieve in Sweden. First, a few words about Sweden. To give you some kind of background to what kind of country we are. We are one of the countries in Northern Europe, fairly small country with a population of 10 million people. We have an elderly population, like many countries in Europe, but maybe more extreme so than many others. We have a good public health in general. Our life expectancy is high, almost 85 years for females, 81 years for males. And we have an extremely low maternal child mortality rate. The health system in Sweden is a universal healthcare system, and it's publicly financed and heavily subsidized for the individual. It is also important to know and to understand that this healthcare system in Sweden is very decentralized. Most of the healthcare is run by the 21 regions, but the elderly healthcare and many other things are run in the 280 municipalities, and the national level has limited possibilities to influence how it's run. The government in Sweden has a number of ministries like everywhere else, and there is a number of agencies. The Public Health Agency, with a number of other agencies, is under the Ministry of Health and Social Welfare. We are very much governed, especially when it comes to Covid-19, by the Communicable Disease Act, which gives a lot of responsibility to the regional level, but also to the agency level to handle most of the things, and very few things are actually handled at the ministry level. There is in Sweden, since a long time back, a high level of trust for public authorities, and we can run many public health programs on more or less the people's own initiatives. We do not at this point have a state of emergency possibility in Sweden, and we cannot by law lock down society without instituting new laws. The Public Health Agency in Sweden, I think it's important to understand that we are a public health agency with a very wide mandate. We worked in a wide area of public health. We work with non-communicable diseases, we work with drug abuse. Health inequality is very important according to the political level for us. So that's what we do in many areas. When it comes to COVID-19, it's important to understand that we have a national responsibility for the communicable disease prevention and control, but it's a coordinating responsibility. Most of the actual operational things, they happen at the regional or even at the local level. We do, of course, collect and analyze and report a lot of data, even more right now, on communicable diseases and many other aspects of public health. So the COVID-19 strategy in Sweden, basically we are trying to do what many countries are doing, and that is to minimize mortality and morbidity in the mortality as a whole, and to see to it that the measures we put in place don't have too much of a negative effect for individuals and the society. It's also important to identify risk groups. It's important to have things in place, measures in place that have a high level of sustainability and flexibility, because we all understand that we're going to have to live with this disease for a long time. We need to mitigate a number of other negative health effects that we see during this, not least a lot of mental health disorders that tend to become a lot more common. We try to work with evidence-based recommendations. We have to realize that when it comes to COVID-19, many things we don't know very well yet, but knowledge is improving, and we can also to a certain extent use knowledge we have in other areas of communicable diseases. So what has the development been like in Sweden? We had a massive introduction early this year in February, when there was a holiday in Sweden and many Swedes were traveling all over Europe, when there was a lot of transmission in many countries in Europe. The peak in Sweden came rather early. It was already in the end of March, beginning of April, and since then there was a slow decline during the spring, and we had a very low level of spread during the summer. We can now look back at to see the viruses that are spread in Sweden right now, and we can, by looking at those, see that we got the disease coming from a lot of different countries, not only from the Alps and not so many from Italy. Actually, most of them came from places like UK, US, and many other countries. So far, we have had 70,000 cases diagnosed. 2,600 people have been in ICU, and we have slightly more than 6,000 deaths so far into the epidemic. As in many other countries, the disease has struck different parts of the population very differently. And one thing we all know by now is that it strikes the elderly population very much more than the younger parts of the population. And early on in Sweden, we got a very big introduction of the disease into elderly homes, mainly in Stockholm and surrounding areas, not so much in the rest of the country. And that's what you can see on the graphs here, that early on we had a lot of cases among the elderly. Right now, those cases are much smaller. And when we see a small increase, in different age group, the elderly age group is the one that increases the least. We now see, as you can see on the second graph here, that the number of cases in ICUs are increasing again, even if we are far from the levels that we were this spring. This is still a worrying increase that we're seeing right now, and we're working very hard to minimize the impact of that. Mortality has been discussed a lot. I think one special aspect of the mortality in Sweden is that he's been mainly in the long-term care facilities. Among 80,000 people in Sweden who live there, and are the people that are the oldest and sickest in Sweden. And of course, when you get an introduction into those facilities, the level of mortality becomes much higher than in other parts of the population. But as you also can see, we had a high level of mortality in those places. It went down very rapidly after week 18, 20, and has been on a low level ever since. Now we do see a slight increase again, but it's still on very much lower levels than it was in the beginning of the epidemic. So, as I said, what have we done so far with the pandemic? After the massive introduction in Sweden in February, with a lot of people coming from all over the world, we worked very strongly with containment for a number of weeks. And we worked very much with contact tracing and testing, especially for the people coming back from skiing holidays in the Alps. That worked reasonably well, one must say. We didn't see much spread around those. We stopped the spread that was there, and we can now see that the viruses that came from those parts of Europe are not very common in Sweden at all. But eventually, the Swedish health system was overwhelmed. There was just too many cases, especially in the Stockholm region. And we were forced to move from the containment phase into mitigation phase in the middle of March, and work with other measures to try to limit the spread as much as possible and concentrate on treating our sick people. That worked reasonably well, and as I said, we had a falling number of cases all the way from April, and during the summer and early fall, Sweden had a very low level of spread, much lower than many other parts of Europe. Right now, we do see an increase in cases again, as you've seen on the previous graphs. It's so far not in the elderly, it's mainly in younger adults, and that's why also the effect on healthcare has been much more limited so far. Right now, currently, we're working very much with local restrictions in different parts of Sweden, and trying to get local restrictions tailored to the needs in each regions in place. And that seems to work reasonably well so far, even if it's early days and difficult to know what the exact effect will be. So this has been a combination of binding regulations and voluntary measures. Binding regulations has also taken place in Sweden, even if that's not so obvious when it's talked about in other countries. There was a ban on visiting nursing homes. The education in secondary schools and universities were done on distance during the spring. Big gatherings for more than 50 people have been banned ever since March. And we had travel restrictions in place for a long time until this summer. cafes and restaurants, a lot of regulations are in place because we know that those are high-risk environments for the spread of the disease. We have been communicating extensively and sending these messages to the public, the importance of staying home when you're sick, the importance to working home as much as you can, and all the other things that you can see on this slide. We have done this in the beginning with daily press conferences, right now bi-weekly. We work a lot through different kind of social media or websites, and we have also translated information to the many languages that are spoken in Sweden these days. Of course, many of these things are not so easy for people to adhere to unless they are supported in different ways, and the government has made that possible. For one thing, sick leave, this is much easier these days. The qualifying day, normally you didn't get paid for the first day you were sick, that has been taken away. You don't need a medical certificate to stay home anymore, and risk groups can stay home and get sick leave compensation if they cannot go to work or cannot work on a distance. So what has happened? When we look at how high the compliance can be, we have tried to measure that in a number of different ways. We had a number of surveys done, and we can say that 80% of the people in those surveys answered that they have adjusted their daily life to follow the recommendations that are in place. We also know that the trust in the public health agency and the healthcare institutions is very high and even has increased during this time. Now at the record high at 75% of the population say that they have a high level of trust in the public health agency. We measured also travel by asking for data from our mobile phone providers. And as you can see on this graph, the Swedes lower their travel just as much as our neighboring countries, and even more than some of them. We also know that many people work from home. We can measure that both by questionnaire and also look at mobile phone data and see that something around 40% of the workforce worked from home in the spring when it was at its peak. Nursing homes has been the problematic area, I would say, in Sweden. As I said before, many of the deaths, much of the mortality that we had in the spring originated in those homes, especially some of the homes in the Stockholm and neighboring regions. Exactly why this happened is complicated. There are so many different things that needed to be improved in those nursing homes before we could get the mortality rate to go down the way that it did. And it's also further investigated, among others, by commission that's been put in place by the government to look especially at the problem we have in nursing homes and how they can be improved. But as you saw in the graphs before, the case fatalities and also the number of infected people in those institutions dropped significantly early in the spring and also during the summer. Now we see a slight increase again and are quite concerned about that. Another thing that we did differently in Sweden is that we kept our schools open, something many countries in Europe now do when they close down their societies again. So preschools and schools up to high school in Sweden were open all through the spring and are still open now in the fall. They of course had the same recommendations as the rest of the society, that even in schools you should also avoid crowding, you should have good hand hygiene, stay at home when you're sick, etc. And there is a strong support from most parts of the Swedish society to keep the schools open. And now we know very well that children are not major drivers in this pandemic. There is a lot of other negative effects for children when they are forced to stay home. And they very, very seldom get seriously ill. We have very few cases that needed health care or intensive care in Sweden in those groups. And it's also important, of course, for the workforce that people don't need to stay home and take care of their children. The personal protective equipment is essential in healthcare facilities, of course. There was a problem in the spring to keep them in place all the time, but it was always available, but it was a constant struggle to have enough in storage to feel safe about it. There's been a lot of discussion about the need for them out in society at large, and the evidence behind using them out there is still weak, and we still do believe that keeping a distance is much more important, and that's what we're working very hard with, making that possible in Sweden. It has been possible to do that so far. We have the face mask as a possibility in the future, but so far nobody in the regions or at the communal level has really seen the need for them. So we keep waiting to see if they're going to be needed somewhere in Swedish society. So finally, to come down to some key points about the Swedish strategy. Sweden has worked with containment and mitigation measures very much like most countries in Europe, but they have been adapted to the Swedish setting, taking into consideration the government structure, systems in place, contingency plans we have in place, legal possibilities to do a number of things, and so on. The level of enforcement of response measures, where we have worked mainly with voluntary measures, and that has been possible in Sweden, and we can see, as I've shown you in this presentation, that the effect of those has been almost as high as legal measures in many other places. And with the big trust we have for the agency in Sweden, it has been possible for us to work in this way. And the situation might be different in other countries. The pandemic in Sweden has developed differently than it has developed in our Nordic neighboring countries, and it has looked much more like it has done in some of the Central European countries like Belgium, the Netherlands, UK, and so on. And still, we seem to follow much more similar patterns to those countries than we do to our Nordic neighbors, and exactly why, something we need to investigate in the future. But Sweden is quite different from our Nordic neighbors in many ways. There has been a lot of consequences of this pandemic in many ways. We can see that health inequalities are increasing again, both in Sweden and globally, and that's something we need to take into account when we get out of this pandemic. But we are still in the middle of the pandemic. It's too early to evaluate, and definitely too early to stop having restrictions in place. So thank you very much, and I'm sorry I couldn't join you in person this time, but maybe sometime in the future. Thank you very much.